Guys, let's see about neonatal sepsis today. Neonatal sepsis can be generalized sepsis or localized sepsis like pneumonia, meningitis, or bone and joint infection. We have two categories: early onset sepsis, which occurs within 72 hours after birth, and we have late onset sepsis, which occurs after 72 hours of birth. The early onset sepsis is mainly due to maternal source. It can be detected. Risk factors are foul smelling liquor, chorioamnitis, rupture of membrane for more than 72 hours, and also dirty pervaginal examination done frequently. Late onset sepsis, it is usually a healthcare associated infection, poor cord care, umbilical sepsis, pyoderma, low birth weight since the infants have less immunity, and lack of breastfeeding also. Early onset sepsis mostly presents as pneumonia and it has high case fatality. Early onset sepsis is equal incidence and it has relatively better prognosis. The most common organisms in India are Klebsiella, Staph aureus, and Acinetobacter. For early onset sepsis, mostly in developed countries, we have Group B Streptococcus, E. coli, and also Listeria. The symptoms in neonatal sepsis are very vague and non-specific, so it requires high index of suspicion. Altered feeding pattern is the earliest sign seen. The infant can also develop lethargy, hypothermia, respiratory distress, abdominal distension, vomiting, and shock. Investigation, we have sepsis screen. Treatment consists of supportive care and antibiotics. Supportive care includes temperature management, airway, breathing, circulation, and nutrition management. Empirical antibiotics should be started in high index of suspicion. Low resistance regions, we can use ampicillin and gentamicin. For high resistance regions, we can use ciprofloxacin, amikacin, or piperacillin tazobactam with amikacin. The general logarithm is suspected sepsis in less than 72 hours. If the infant is under high risk, then we should do a blood culture, and if we are suspecting meningitis only, we should perform LP. Then we should give empirical antibiotics. If there is no risk factors, we should monitor the infant. If the age is more than 72 hours, there is no symptoms, we can monitor the infant as long as the infant is fine. If it is more symptomatic and if it is sick, we should do culture, LP, and antibiotics. If it is not sick, we should do sepsis screen, followed by which we can decide whether culture is needed or not. Antibiotic resistance is a growing problem. So for prevention of this, we have antibody steward program, which advocates the use of right antibiotic at the right time for the right duration through the right route. And we also have prevention of sepsis. We have 6 cleans at the time of delivery, which is clean hands, clean delivery surface, clean perineum, clean and dry cord care, clean cutting, and clean towels. Thank you.